The Northwest Health Department has now confirmed a rise in measles infections or cases in the province. The Health MEC Madoda Sambatha is currently leading a campaign to raise awareness around the measles outbreak. Let's take you live there to our reporter, Refiloe Seboko, who's live for us in Lichtenburg. Refiloe, how much knowledge do people in that area have at the moment about the measles outbreak?
Well, Tebekile, MEC of Health in the Northwest Province, Madoda Sambatha, is here to share that information and so that residents can have knowledge as to what is measles all about. You understand that the encouragement is that parents need to see the booklet and see the progress, especially of immunization of the kids from as young as 1 to 15 years. And we are seeing young kids are here, Tebekile, to get their shots. But allow me to welcome MEC Madoda Sambatha to tell us about what's happening here. Also, MEC, the concern that there's been a rise in cases reported in the province of measles. Welcome to Newzroom Afrika.
Thank you very much. We are not the only province affected. It's a worldwide outbreak. We are affected because World Health Organization standards is that 3 cases makes you to be in an outbreak. So we had 4, all of them in Lonely Park, but as we speak, we have 7 across the province. Now, the National Department of Health National Minister has issued a call to all provinces to do outreach, also because there's more movement of people around. Let me give a most practical example people don't think of. The outbreak started in Mahikeng. We are having by-elections in Ditsobotla. There's more people from Mahikeng coming to Ditsobotla to campaign. They don't know the status of themselves, and they don't know how possibly could then the transmission occur on the basis of movement of people. So what we have now, we have a program that seeks to ensure that there's awareness outbreak, but also there's vaccination, immunization at a go. As we speak here, where we are, young kids are being immunized. There are others who are immunized at home. When health workers visited during the day and had identified that those ones have not been immunized, they immunized them at a go. And we have said that the next initiation immunization would have been in February 2023. But that has been brought back now. That's why we are immunizing at a go.
And as you are doing the awareness around here, how much knowledge are you seeing that people are knowledgeable about measles and the vaccination of it?
Look, with the South African population, you must deal with the reality of health ignorance. Majority of us as South Africans are too much health ignorant. A person does not check a record card of a child. What does it say about immunization programs and plans? The next time the person checks, he realizes that the child should have been immunized 6 months ago, but I forgot to check a card. But what we see is that people are accepting the education program given to them by healthcare professionals, but they are also willing to contribute in ensuring that they disseminate the information to others. Like I'm saying, there are others we got from their families. And we realized then that this child was due for immunization last year, not immunized, jabbed now with immunization.
In terms of the cases that we have in the province now, MEC, 7 of them in total, the tracing process, how are you doing it in finding them? More that because we also understand that there's somebody who got an infection and traveled to the other area, and that could be the possibility as to why now there are cases in other areas in the province. Take us through the process of the department tracing those who are infected.
Remember the component of COVID, of tracers. That component is a permanent feature of the Department of Health. In which sense, community health workers who our work we value as a department are always an integral of a health outreach program led by an OT and nurse. Now in this instance, cases are analyzed as what might have been possible, the reasons for the outbreak, and then check as to whether are they not close in terms of geographic location to each other. But then we ensure that each one that has been detected, there's a follow-up direct to the family, and then a link as to who has been moving around there as a basis to capture those that might be exposed.
Thank you so much for your time. MEC of Health in the Northwest Province, Madoda Sambatha, they will be continuing with this awareness campaign to make residents aware of this outbreak of measles and also the need for vaccination and also the need for them to keep on checking on their kids' booklets.
Refiloe, Seboko, thank you very much for that update from Lichtenburg in the Northwest. Still